How's it going? Welcome to week 6, module 6. Again, apologies for my voice. I'm going to share my screen now. Okay, so we will be covering Giddens. Just go up here to the learning objectives. So I will pause here so that way you can read each bullet point here for the learning objective. Go. Then hopefully by the end of this session, you will understand these objectives. Okay, so chapter 8, concept of fluid and electrolytes. This is a mouthful. This is big. So be sure to read the addendum under this section as well with additional information. So it is important to note and understand that fluid is water plus substances that are dissolved and suspended in it. Important characteristics of fluid are its volume and the amount and its degree of concentration, which is the osmolarity of the solution. So electrolytes or substances that are charged are usually referred to as particle ions when they are placed in water. Some examples, and I'm sure you know these electrolytes, are sodium ions, potassium ions, calcium ions, and magnesium ions. In healthcare setting, you may recall as practicing LPNs that physicians and your coworkers often omit the word ion when discussing the electrolyte. The electrolytes referring to potassium ions as potassium. So it's also, important to note that as well. The other thing to keep in mind is that with electrolytes, it's important to maintain the physiological balance of body fluid and electrolytes as a dynamic interplay between three processes. And these three processes are intake, absorption, distribution, and output. So intake is referred to as what the body absorbs. So it's the addition of fluid and electrolytes that come into the blood. Once it gets into the blood and absorbed in the blood, that's referred to as absorption. Distribution, however, is the process of moving fluid and electrolytes between the various body fluid compartments. These fluid compartments include inside the cells, which is referred to as intercellular, and outside of the cells, which is referred to as extracellular. So the extracellular fluid is considered the ECF compartment. And this includes the fluid that is in between the cells. And you probably heard it referred to as interstitial fluid. And that and then there's the fluid inside the blood vessels, which is referred to as the vascular fluid. The output part is removal of fluid and electrolytes from the body through either normal or abnormal routes. There's some important figures in chapter 8 of Giddens. Make sure you look over them so that way you can get a better visual. The fluid distribution between the vascular interstitial compartments occur by filtration, which is the net result of simultaneous opposing forces at the capillary level. And then you have renal excretion. This provides the largest output of fluid and electrolytes in normal circumstances. And there are also hormones that are involved with this process. Um, excuse me. A big one is aldosterone, along with the natriuretic peptides, which is not discussed in this concept presentation, but it does regulate renal excretion of sodium and water. Isotonic fluid, um, it also regulates the isotonic fluid, whereas the antidiuretic hormone ADH regulates excretion of water. So that's important to keep in mind. Aldosterone increases renal excretion of potassium directly and magnesium indirectly. So make sure you look at those figures to help understand those roles as well. So you might be asking yourself, what's the nursing responsibility with all of this? Well, those are all collaborative interventions. So you as the RN are involved in working with the healthcare practitioner in correcting electrolytes. So the extracellular fluid volume deficit, or even access fluid volume overload. So usually you monitor the fluid electrolyte replacement using IV fluid measuring, you know, products that we have. Um, and then the fluid intake and output monitoring for complications of therapy. As the RN, you'll be involved in teaching patients and families regarding the therapy that is prescribed. Like treatments for extracellular fluid volume access might have sodium restriction. You can have water restriction for a hyponatremia patient. You can have decreased intake of it, of electrolytes that's excessive. As RNs, you need to be sure that people know the reason for the restrictions, um, and they incorporate their culture, right? Because you got to make sure it's culturally appropriate teaching um, regarding how to change their diet or fluid intake, right? Because we do want the patient to ultimately, or the caregiver to take care of the patient. So depending on the situation, these medications are directed towards various goals. Treating the underlying cause, you might have to give antiemetics for imbalances due to vomiting, or vasopressin for ADH deficits. If they're deficit in ADH, um, uh, and you can increase the output of fluid or electrolytes. Also, you can give diuretics ordered by the healthcare professional for fluid overload, or for extracellular fluid volume excess or severe hyperkalemia. Sometimes you might do it just for hyperkalemia. The patient has too much, a high potassium level. Um, but you might also give insulin and dextrose IV, um, because that will shift the potassium back into the cell. So remember how we spoke about extracellular and intracellular. So the insulin and dextrose will shift it back into the cell, so that way the potassium may be used. Excuse me. And out of the bloodstream. Excuse me, I had to take a swig of water. Also for high calcium, so you might give calcitonin for acute hyperkalemia. I'm sorry, for acute hypercalcemia, which counteracts the life-threatening effects of that imbalance. So that's kind of how the RN is involved in fluid and electrolyte balance. There is more in-depth details about this. Again, read the addendum that is added, and be sure to record your answer to this question on fluid and electrolytes. Okay, so our next concept here is acid-base balance. And remember, if we have time, we'll do the tic-tac-toe. A lot of students like that with ABGs. It helps them understand it. It's easier, and it's a fun way to actually interpret the blood gases. But remember that you do need to understand it because it's one of the NCLEX requirements that you have to know. So an acid, um, so let's get into it. So an acid is a substance that releases hydrogen ions, and a base is a substance that takes up hydrogen. The most important base in the body is bicarb, bicarbonate. So a pH of 7.4 is what we call normalized pH, and greater than 7.45 is alkaline, and less than 7.35 is acidic. Acid production is the generation of acid through cellular metabolism. So our cells continuously generate two kinds of acid during metabolism. They are the carbonic acid, which is H2CO3, and metabolic acids. Although the chemical structures of metabolic acids vary, both normal and abnormal types of cellular metabolism, they can generate metabolic acids occasionally, which can occur, and it can involve entry into the body of acids or substances that the body converts to acids, which are acid precursors. Acid buffering is a process by which the body fluids resist large changes in pH. So acids or bases are added or removed. Body fluids normally have a free switch, are pairs of chemicals that take up origin or release it to keep the pH in the normal range. Acid excretion is removed of acid from the body, changes in rate and depth of the respirations alter the amount of carbonic acid that is exerted. Hyperventilation increases rate and depth of respiration. It excretes more carbonic acid. Hyperventilation decreases rate and depth of respiration. It excretes less carbonic acid. The chemoreceptors influence respiratory rate. It ends up in response to the blood levels of CO2 and hydrogen in some situations, oxygen, adjusting their hydrogen secretion rate and the amount of ammonia they make. The kidneys that are made in the kidneys will cause the kidneys to be able to excrete more or less metabolic acid by maintaining optimal acid-base balance of too much metabolic acid, which is present in the blood and kidneys, which can in turn increase the creation of hydrogen and make more NH3, which is ammonia. And sometimes in our patients, we might take their ammonia level. So that is the basis of acid-base balance. And like I said, we can practice some ABGs, blood gases, through the tic-tac-toe method. Okay, so that covers this slide. I'm so sorry, guys. My throat is just not with me today. All right, so answer this question on your your document, ticket to lab. Okay, so the next concept here is concept of elimination, and it's the last concept. So um, elimination, remember the prevalence of urinary incontinence ranges from 19% in women age 45 years or younger to 49% in women age 80 years or older. Men are more likely to experience urination difficulties as they age because of changes with the cell hyperplasia in the prostate gland that may cause either urinary retention or increased urinary frequency due to incomplete emptying of the bladder. There might be many reasons why incontinence increases with age in both genders, including pelvic floor weakness. There's muscle weakness in women. There's neurological problems, and there's medications that interfere, such as diuretics, can contribute to the involuntary loss of urine in both men and women. Several medical conditions can place an individual at risk for alterations in urinary elimination, such as brain attacks or a vascular accident, spinal cord injuries, diabetic neuropathy, dementia, including Alzheimer's disease, HIV, AIDS, or other autoimmune diseases and conditions that are specific to the urinary system. Um, there's urinary calculi, kidney stones, um, large prostate, which we call benign, um, BPH because of the prostate hypertrophy, um, or even acute infections and chronic infections, such as that can occur in both men and women for both acute neurological injury and progressive neurological changes with advanced age. There's excessive use of medication, such as laxatives. It can contribute to incontinence issues involved in both genders at, cognitive impairments, those that are exposed to radiation for treatment purposes. They take multiple medications, um, consuming extra caffeine or above the limit, or have limited access to toilet facilities because of immobility or environmental or social cultural factors. There's risk behaviors that place individuals, they'll have retention issues. Um, there's lack of adequate fluids, fiber, or exercise even, as well as use of medication, um, such as diuretics, narcotics, antidepressants, anti-anxiety medications. Pregnancy also increases the risk of stool retention because of the pressure of the fetus in the bowel. You can see, there's a lot of nursing skills necessary for elimination, and we'll kind of go over them in lab and simulation throughout the rest of the semester. Okay, so here is the question on elimination. Gonna pause there. And these are the learning objectives. All right, thank you so much for bearing with me.